Over the last 24 hours, we have identified 513 new cases of COVID-19 and completed about 9,000 tests. Our positivity rate currently stands at 6.1%. Like cases, hospitalizations continue to decline, which is promising. There are now 538 people in hospital being treated for COVID-19, including 150 in the ICU. Sadly, I must announce that one new death was reported to Alberta Health in the last 24 hours. While it is good to see a decrease in the number of daily deaths, each death is yet another reminder that while we are rolling out the vaccine and looking forward to brighter days ahead, this virus is not yet tamed. I want to extend my sympathies to the family and friends of this Albertan and to anyone else who has lost a loved one to any cause. Providing protection to as many Albertans as possible through immunization is the way we can collectively prevent more tragic losses like this one. Yesterday, Premier Kenney announced Alberta's Open for Summer plan for easing restrictions based on vaccine uptake and hospitalizations. My team and I were fully engaged in the development of this plan. We looked closely at the evidence seen in other countries, including Hungary, Israel, the UK, and several US states, as well as other Canadian provinces that had announced their opening plans. I believe this plan is a prudent approach to reopening, with Stage 1 prioritizing the easing of low-risk outdoor activities and only proceeding to the next stage as thresholds are met and the 2-week window ends. This stage is much more cautious than what you see in our neighbouring provinces, BC and Saskatchewan, in their easing of Stage 1 because we have recently had higher cases. We also considered the fact that the public health measures that have been needed over the past year are unprecedented in our lived experience and that they come with significant public health impacts as well. We have used these measures to save lives and protect the healthcare system from being overwhelmed, but these interventions have never been taken lightly. It is my opinion that we need to be as mindful of recovering from the impacts that the last year has had on Albertans' mental health, well-being, and determinants of health, as we are of the direct impacts of COVID-19 infection. All of these considerations helped inform our team's recommendations to Cabinet. For example, it was our recommendation that the plan focus on the percentage of all Albertans 12 and over who have the vaccine, instead of just the percentage of adults with a first dose, as some other jurisdictions have done. Based on best available science, we recommended the threshold of 70% with at least one dose in this age group as the metric for the removal of most mandatory public health restrictions. This maximizes the protection that we will have before significant reopening takes place. It is important to remember that the 70% trigger is a public target that protects Albertans and is a goal that we can all help to achieve. Every Albertan can rally together to achieve this level. However, Alberta's plan has many other factors that underpin it. This includes overall community protection, including post-infection immunity, second dose vaccine uptake, and vaccine effectiveness. It also includes monitoring the spread of the virus in the province and our health system capacity. All of these are essential parts of safely reopening and keeping cases down so we can stay open for good. And they are all accounted for in Alberta's Open for Summer plan. My team will keep closely monitoring case levels and hospitalizations, including ICU admissions. If we start to see cases rising over an extended period of time, with impacts flowing into severe outcomes, the plan allows for any needed adjustments. I know that some Albertans are wondering why second doses are not specifically mentioned in the plan. We focused on first doses because that is the most immediate target that we need to reach. But let me be clear, second doses are essential and are an integral part of the plan. For this plan to work, we need as many Albertans as possible to get a first dose and then get a second as soon as they are eligible to do so. We wanted to make sure that between hitting one trigger and then moving to that particular opening stage, there was a full 2 weeks so that people were achieving a level of protection. We know that when people first receive their immunization, they don't have a significant level of protection in the few days following that. We know that we start to see a difference in the protection that vaccine offers at that 2-week mark. And so it was important to make sure that when we hit those metrics, we weren't moving immediately to opening up our measures or increasing activity levels, but we were waiting for that immune response to mature and to be able to have the full impact. It's also important to remember that when we hit a particular target of a certain percentage of Albertans 12 and over being immunized, many of the people in that group would have received vaccines in the days and weeks prior to that. So hitting that target and waiting the 2 weeks, again, gives that maximal opportunity for protection to come into effect and to therefore, again, allow these levels of protection to increase as we slowly ease the public health measures.